and welcome. Diabetes in India is a growing health problem with more than half of the population at risk of developing the condition at any given time in their lives. Diabetes mellitus is a widely diffused chronic condition that impacts several aspects of patients' lives. If you do not manage this condition, you may develop more severe complications. There is no cure for diabetes, but with well-managed diabetes, you can prevent many complications of diabetes. Diabetes management is about more than blood sugar control. Most people are still unaware of this fact. There's a much more debate around the cure and reversing of diabetes. People are being misled by half-truths or inaccurate information. There are several misconceptions about diabetes management and treatment, so it's important that people get correct information about it. To discuss these and other issues regarding diabetes, we have with us today an esteemed panel of experts. But before that, if you have any questions you would like to ask them, send them to us via WhatsApp to the following number. That's 9167666941. That's the number to send all your questions for our experts. Do also send us your name and your location. To begin with, we have Dr. Brij Makkar, diabetologist and bariatric physician, director at Dr. Makkar's Diabetes and Obesity Center in New Delhi. We also have Dr. Vijay Viswanathan. He is the National Vice President of RSSDI, the Head and Chief Diabetologist, Professor M. Viswanathan Diabetes Research Center in Chennai. Now, very good afternoon. Let's begin with a WhatsApp question coming from Bengaluru from Deepa. Deepa is asking, is keto a sustainable lifelong diet for managing diabetes, for managing obesity and also the metabolic disorder? What are the adverse effects? Let's me take this question to Dr. Makkar. Makkar, if you could answer this question for us.
Yeah, I think it's a very important question in current context because, keto diet has become one of the big fads in nowadays lifestyle modifications. Now, if you look at keto diet, what is keto diet? It is basically a low carbohydrate diet where more of fat is replacing the calories that are consumed normally in from carbohydrates in a normal diet. So you have more fat, less carbohydrates and adequate or more protein in keto diet. Now what this leads to, now body normally consumes carbohydrate as primary source of calories. Now once you are not providing carbohydrates, it utilizes fat, and ketones are basically produced from fat which are utilized as source of energy. Now this leads to decrease in appetite, and this can help you lose weight over a period of time, can improve blood glucose levels and so on. So short time you get all kinds of good effects, but it also leads to some side effects which are commonly, in short term you can get a condition, something called keto flu, which is like people get diarrhea, people get abdominal upset. They have sleep disturbances, there can be disturbance in mental function, less concentration, and so on. Second thing is, it is not sustainable over a period of time. And if you are taking it over a long period of time, there are studies which have shown that it can have its own long-term effects, because you are going deficient on carbs, proteins, you can end up with protein deficiency, you can end up with micronutrient deficiencies, you can have increased fat accumulation in liver, which can have its own side effects. People get kidney stones and so on. So there are multiple things which can happen in long term also. So it's not a sustainable diet. It can be used as a short term measure for inducing weight loss, but certainly not a long term solution.
Right, that takes me to my next question to Dr. Viswanathan. Type 2 diabetes cannot be cured completely. This statement dispirits every person who has diabetes. But is it possible to reverse diabetes or get free from the daily medication? Dr. Viswanathan?
Yeah, so I think it's a very good question. But the fact remains that type 2 diabetes is a very complicated disorder. There is a genetic component and there is a lifestyle fault component also. There's a faulty lifestyle. Now, if you take a problem like cancer, it's got the same genetics, lifestyle, and so on. But we do not ask the same question about cancer. Similarly, for diabetes, you can understand that you need medications to make the insulin work better. You have to change your lifestyle. And your question whether it's possible to live without medication, it all depends on the insulin resistance. If the insulin resistance or the faulty lifestyle can be modified, you can reduce the number of medications. The number of medications go up only if you don't change the lifestyle. Genetics, of course, you cannot change. Now, last part of your question, reversal of diabetes. So, reversal of diabetes is a very important term. Now, you cannot reverse the diabetes in about 90% of patients, of people who already have developed diabetes. Now, you can only keep it under control. However, people who are overweight, people who are overweight, who are leading a very faulty lifestyle, if they change their lifestyle and if they become less obese, you can sort of reverse diabetes. So, reversal of diabetes is possible if you change your lifestyle, number one. Number two, if you lose lot of fat in your viscera, about which I think we'll be answering a little later, visceral fat. So, reversal of diabetes is possible with a good lifestyle and also by using medications for some time. So you cannot be not using medication at all. If you use medication initially, you can go off the drugs after some time. Thank you.
Right, Dr. Makkar, what is the difference between diabetes cure and diabetes reversal or diabetes remission?
Again, very important question. So cure simply means that you have got rid of diabetes and there is, you have permanently got rid of the disease and it is not going to happen again. That's what is the understanding of cure is. Now there is, when we say reversal, technically if you look at the, so-called literal meaning of word reversal, it is something like moving back. Now you can move back few steps, you can move back few meters, few kilometers, everything is, as long as you are going in reverse direction, it is reversal. So reversal is more of a lay term when we say that, okay, you have reverse diabetes, that means your sugar levels are normal and you are no more on medication. The technical word is remission actually. Remission means that your disease process for some time has gone into remission. That means you are no more having symptoms or signs of the disease. There may be still underlying process which is, underlying abnormalities which you are not detecting clinically. But for all clinical purposes, you don't have the disease and you don't need treatment. But as Dr. Vijay very clearly said, diabetes is a very complex disease. There is a genetic predisposition, there are environmental factors, and there are multiple other things that we may not be completely understanding of today. So when we say remission, we say that today you have got into a state where clinically you don't have diabetes, but it can come at a later date. Suppose somebody loses weight significantly and gets into remission of diabetes, then good chances when the person regains body weight will develop diabetes again. Second thing is, suppose person does not regain weight, the tendency because of the genetic predisposition will stay. Now suppose this person was destined to become diabetic at a stage of, say, at the age of 60 years. He became overweight, obese, got diabetes at 50 years, lost weight, went into remission at 52 or 53. At 60 years, again his genetic predisposition is going to push him back to diabetes. So remission is a transient phase basically, that you have got a disease, you dipped into the normal phase, you are likely to come back. Reversal is something like, I have a patient who is doing bad, he is on multiple medications and we have improved the stage. So to some extent we have reversed from that bad state to a good state.
Right.
We may not be fully.
Doctor,
but
my next question.
For lay persons, it is the same. Reversal and remission mean more or less same thing.
Right. So doctor, this brings me to the next question, which is weight loss. How crucial is weight loss in the management of diabetes, and what's the best way for a person with type 2 diabetes to lose weight? Dr. Makkar?
So weight, is body weight is a major issue actually, and it is the most neglected issue in most of the patients with type 2 diabetes. Here, what I'm telling you is all relating to type 2 diabetes and not type 1. And type 2 diabetes accounts for more than 95% of diabetes persons in Indian setting. Now, if you look at the data, almost 80% of people with diabetes have overweight or obesity. And obesity is one of the key drivers for development of diabetes. And there are multiple studies which have shown that if somebody loses, say, about 15% or higher body weight, good chances that person will go into remission of diabetes. Now, how to lose this weight? The major, component of weight reduction always remains lifestyle interventions, which include changes in diet, reduction in the calorie consumption, moving to a healthier diet, and a regular physical activity. If that is not sufficient to induce weight loss, you have to take help of medications, and currently we have some medications which are very potent and help you in losing weight to the extent of 15 to 20%. And if nothing else is working, then one has to resort to bariatric surgery. So if you ask me one single best method of weight loss, there is no uniform formula. There is no single formula that fits all. Depends on person to person, patient to patient. We need to customize, according to the situation.
Right. So, Dr. Viswanathan, my next question is to you. How is the specific treatment for diabetes determined? Is the treatment for diabetes different for each person? Dr. Viswanathan?
Yeah, it's a very good question. I'll give you a brief answer. See, every person with diabetes goes through two stages. The first stage is where the insulin is not working in the body, the stage of insulin resistance. At this stage, even lifestyle modification is enough. You may not need tablets. Now, some people are not able to do lifestyle modification, so they'll need a tablet called metformin or some other drugs. Then comes a stage where there is beta cell failure. The beta cells are the cells which produce insulin. They are not working anymore. At that stage, you need stronger medicines and you need a much better lifestyle modification at that stage. Now, there will be still beyond this one more stage where the beta cells are totally not working. At this stage, you might need insulin also, insulin in addition to tablet. So there are specific treatments depending on the amount of insulin which is available in the body, insulin is working or not, and so on. So there are basically two stages, and then you go on to the third stage. Thank you.
Right, 2 to 3 stages of treatment of diabetes. With that, we're slipping a very short break. But if you have any questions and you would like to ask them, send them to us via WhatsApp to the following number. That's 9167 666941. That's the number that you can send your questions to. Also, send us your name and your location. With that, we're slipping a very short break. Welcome back. You're watching our special show on diabetes. We've been talking to Dr. Makkar and Dr. Viswanathan. Now we also have Dr. Anuj Maheshwari, the National Vice President of RSSDI, Shri Hari Kamal Diabetes and Heart Clinic from Vikas Nagar of Lucknow, joining us. Thank you so much, Doctor, for joining us. My question to you would be, what foods should a person with diabetes eat before and after exercising? Dr. Anuj Maheshwari.
Yes, thank you for asking this question. In a diabetic person, the biggest issue remains hypoglycemia, especially when he is well controlled in his blood sugar. So avoiding hypoglycemia during the exercise is very much important. That before exercise one should take carbohydrate rich food. Most likely we should allow the person to take at least a carbohydrate in which 15 milligram of the carbohydrate should be there. After the exercise, we should try to have a lot of water. That water may be protein-rich fluid, that may be water, that may be plain water, or that may be some juices. And sometimes the protein food is very much required after the exercise, especially if one has done the vigorous exercise, because it helps in improving the muscle mass. So before exercise, we should take the carbohydrate-rich food. After the exercise, we should take a lot of water and some protein so that the muscle mass can be well taken care.
Right. My next question is, what is the relationship between vitamin D3 levels and blood glucose levels? If Dr. Makkar could take that question.
Again, the very important question. See, vitamin D, we always considered this to be a vitamin which is more related to the, normal calcium levels in the body and the bone, mineralization. But in last decade or so, we have started understanding the multifaceted actions of vitamin D in various metabolic processes in the body. And diabetes appears to be one of the areas where vitamin D appears to play a very important role. Now there are studies which have shown that vitamin D deficiency can actually increase the risk of developing diabetes and also may be associated with poor glucose control levels in persons with diabetes. Now, if you look at persons with diabetes, there are two core defects. One, as Dr. Vijay also mentioned earlier, there is resistance to the action of insulin, and second is there is decrease in the secretion of insulin. And vitamin D has been shown to improve both the sensitivity of various body tissues to action of insulin as well as improve the insulin secretion. Now there are studies which have also shown that in neonatal stage or babies or early childhood, the optimum vitamin D levels reduce the risk of developing type 1 diabetes also. And there are studies which have also shown that vitamin D may be protective against development of gestational diabetes in young women who are going towards pregnancy or conception. So there are multiple studies showing an association between low levels of vitamin D3 and various aspects of diabetes management and diabetes prevention. However, we don't have very concrete data as of now, but there are very strong suggestions that full in prevention as well as maintaining good control of glucose.
Right. Thank you so much for that answer. My next question is, how does insulin resistance affect the lipid accumulation in the body, and how can it be managed? Dr. Vijay Viswanathan.
Yeah, I think it's a very good question and very important question as far as diabetes is concerned. So what happens is there is accumulation of fat, bad fat, in the internal part of the body, the viscera. It's called visceral fat. Viscera means organs. So it can be in the liver, it can be in the intestines, anywhere inside the abdomen. So this is called visceral fat. Now, visceral fat is the key to developing heart disease and diabetes and so on. Now, what do we do? Your second part of the question is, what do you do to reduce this visceral fat? The visceral fat can be reduced only by doing weight reduction. You have to lose weight. You have to do exercise, weight reduction. You have to reduce carbohydrates in your food. And there are drugs, latest drugs and the older drugs, which can reduce visceral fat. So visceral fat is the key to developing heart disease, diabetes, and even cancer. Thank you. It's a very good question.
Thank you so much, Doctor. Well, my last question is to Dr. Maheshwari. What is glycemic index and why is it essential for people with diabetes to be aware of it? Is it beneficial to consume low GI foods? Dr. Maheshwari?
Yes, of course. It is beneficial to consume low GI food because in India, most of the food is constituted by the carbohydrate. GI, glycemic index, means how fast the food is being absorbed and it is reaching to your blood. So if a food is having better tendency of getting absorbed and reaching into the blood vessels in the blood, then it is very easily causing a hike in blood sugar level. In a diabetes patient, this matters a lot because in a non-diabetic patient, it does not make much difference because as and when the person will eat something, the same amount of the insulin will release and the person will materialize and do the needful for the food, whatever he has taken. But in a diabetic person, as we do not have enough insulin to take care of that glucose, what is reaching there, then it is very much important to use the low GI food, and especially the food which is having the high glycemic load but low GI, they should be used because they are keeping a person much better state, keeping the glycemic level for a longer time. For example, I can tell you oatmeal, whatever we many a times we prefer to take the oatmeal in the breakfast. Oatmeal is having very good amount of the carbohydrate. It is having 100 gram of the oatmeal is having 25 gram of the carbohydrate, but it is having very poor glycemic index. Because of what? Once we take that oatmeal, that remains suffice for long hours, at least 6, 7, 8 hours for a person, because it is getting very slowly absorbed and it is getting very slowly reaching to the blood vessels, causing you more energetic for a longer time, and you don't get enough energy or so much of the glucose at once upon a time, and you are getting the hyperglycemic. For diabetic person, it is very much important to take care of the glycemic index and know better which food is having low glycemic index despite high glycemic load. And if a food is having low glycemic load and low glycemic index, this will be working for a short time. But high glycemic load, less glycemic index will be working for a longer time, and you will not be requiring a food to take again and again.
Right, Dr. Maheshwari, any advice of patients who have type 1 diabetes and they might also be suffering from COVID-19?
Yes, definitely. The type 1 diabetic patient has also had a COVID-19 kind of the risk, as they were having a risk of the hyperglycemia. Especially the COVID-19 was related to the hyperglycemia. It was not related to the type 1 or type 2 diabetes. If a person is having hike in the glucose level, it was more chance of getting COVID-19. And type 1 patients are more causing the hyperglycemia. They are difficult to control hyperglycemia. That's why it remains always a chance of getting COVID-19 or any infection earliest possible in them.
Right. Thank you so much, Dr. Maheshwari, Dr. Makkar and Dr. Viswanathan for joining us here on the show Beat Diabetes Myths and Facts. If you have any questions you would like to ask, send them to us via WhatsApp to the following number. That's 9167666941. This is the number you can send your questions to. Also send us your name and your location. Thank you so much for watching.